She sat at the kitchen table staring at the calendar she had always kept meticulously, the one filled with appointments and birthdays and little notes to herself. For the first time in years, the dates looked unfamiliar. She could not remember whether her granddaughter's recital was last week or next month. The word for the appliance humming in the corner of the room refused to come. Her husband watched quietly from the doorway and felt a quiet fear settle in his chest. Later that week, the doctor used the word cognitive decline and asked about her medications. What followed was a careful conversation about pills she had taken for years without a second thought. Stories like hers are becoming more common across America. Millions of people over 40 take everyday medications for sleep, allergies, bladder control, anxiety, or pain, never realizing that long-term use of certain ones may raise the risk of dementia. Today we are going to walk through 9 of the most common ones, the science behind the concern, and the practical steps you can take to protect your brain without panic. This is not about fear. It is about awareness and the quiet power of informed choices. If this topic already feels personal, take a moment right now to like this video and subscribe to Health Journey. So many of us are watching parents or partners navigate memory changes, and every subscription helps this channel keep sharing clear, compassionate information that families actually need. We are walking this path together. The quiet worry that something is shifting in the mind can feel isolating, yet knowing you are not alone often becomes the first step toward clearer decisions. Your brain is a living network of pathways that rely on careful chemical balance. Certain medications can interfere with that balance over time, especially when taken daily for years. The strongest and most consistent evidence points toward drugs with anticholinergic effects. These medications block a chemical messenger called acetylcholine that is essential for memory and learning. When that messenger is repeatedly interrupted, the brain can struggle to form and retrieve memories. Over years, the cumulative effect appears linked to higher rates of dementia in large observational studies. The risk tends to rise with higher doses and longer duration, and it is more noticeable in people already carrying other risk factors such as age, family history, or vascular problems. That does not mean every person who takes these drugs will develop dementia. It means the risk is elevated enough that doctors now routinely review anticholinergic burden in older adults. Think of acetylcholine as the quiet conductor that keeps the orchestra of memory in time. When the conductor is repeatedly silenced, the music begins to fray. The first medication on our list is diphenhydramine, the active ingredient in many over-the-counter allergy and sleep products including Benadryl and the PM versions of common pain relievers. People reach for it because it works quickly for a stuffy nose or a restless night. Yet it is a strong anticholinergic. Long-term nightly use has been associated with increased dementia risk in multiple large studies. Many people do not realize they are taking it regularly because it hides inside combination products. A woman in her late 50s once described how she had taken a popular PM tablet almost every night for more than a decade. When her memory began to slip, she assumed it was simply aging until a pharmacist pointed out the connection. After switching under medical guidance, she noticed clearer mornings within a few months. If sleep is the reason you reach for it, there are often safer approaches to discuss with your doctor, from improved sleep habits to medications with lower anticholinergic activity. The relief these products offer is real, yet the long-term cost to the brain deserves equal attention. The second is oxybutynin, a common prescription for overactive bladder. It helps quiet the bladder muscle and reduces urgency, which can restore confidence and sleep. Unfortunately, it is also a strong anticholinergic that crosses into the brain. Research has shown higher dementia rates among long-term users compared with people who never took it or who used alternatives with less brain penetration. Newer bladder medications exist that stay more in the body and less in the brain. Asking about those options can make a meaningful difference for someone who needs ongoing treatment. One man shared how the constant urgency had stolen his ability to sit through a movie or a long drive. The medication restored that freedom, yet after several years he began forgetting conversations mid-sentence. When his doctor switched him to a different class of bladder medicine, the fog lifted enough that he felt like himself again. Stories like his remind us that effective treatment does not always have to come at the highest cognitive price. The third involves certain older antidepressants known as tricyclics, with amitriptyline being one of the most prescribed. These medicines have helped many people with depression, nerve pain, or migraine prevention. Their anticholinergic strength is high, and studies consistently link long-term use to greater dementia risk. Newer antidepressants often carry lower anticholinergic burden while still offering mood support. The decision to change is never simple and must be made carefully with a clinician because abrupt stops can cause real problems. The important point is that alternatives frequently exist once the conversation begins. Depression itself carries risks for the brain, so the goal is never to leave someone untreated. It is to find the support that protects both mood and memory. Many people discover that after a careful transition, their thinking feels sharper even as their emotional balance remains steady. The fourth category is benzodiazepines, the familiar names like alprazolam, lorazepam, and diazepam used for anxiety or insomnia. These drugs calm the nervous system quickly, and many people have relied on them for years. Observational research has repeatedly found higher rates of dementia among long-term users, especially with higher doses and longer duration. The drugs can also cause daytime fog, falls, and dependence. Tapering under medical guidance is often possible, and many people discover that anxiety lessens with other approaches once the medication is reduced. The brain can regain some clarity when the constant sedation lifts. Imagine living for years with a soft blanket over your thoughts. When that blanket is slowly lifted, the world can feel brighter and more precise. The process requires patience and support, yet the reward is often a mind that feels more like its own again. The fifth medication is zolpidem, widely known as Ambien. It is prescribed for short-term sleep trouble, yet many people continue it for months or years. Studies have linked regular use to higher dementia risk, and the medication can also produce next-day drowsiness, confusion, and unusual nighttime behaviors. Sleep is essential, but chronic reliance on this particular drug appears to carry a cognitive cost that accumulates. Behavioral sleep strategies and other options often prove more sustainable once a person has support in making the change. One woman described how she had feared nights without the pill more than she feared the growing gaps in her memory. With guidance, she learned new ways to settle her mind and eventually stepped away from the medication. The clarity that returned felt like reclaiming a part of herself she had not realized was missing. The sixth involves long-term use of proton pump inhibitors, the powerful acid reducers such as omeprazole. These drugs have transformed the treatment of severe reflux and ulcers. Some large studies have found a modest increase in dementia risk after several years of continuous use, while other research has not confirmed the link as clearly. The association may involve changes in nutrient absorption or subtle effects on brain inflammation. Short-term use is generally considered low risk. The practical step is periodic review with your doctor to confirm that ongoing daily treatment is still necessary rather than something that can be stepped down or replaced with lifestyle measures. Many people start these medications during a difficult period of heartburn and then continue them out of habit long after the original problem has eased. A simple conversation can often clarify whether the daily dose is still earning its place. The seventh is cumulative high exposure to opioids used for chronic pain. Recent research has shown that when total exposure passes a certain threshold, the risk of later dementia rises, even after accounting for the pain itself. These medications affect brain chemistry in ways that can impair cognition over time. Pain must be treated, yet long-term opioid therapy is increasingly recognized as carrying cognitive as well as physical risks. Multimodal approaches that include physical therapy, non-opioid medications, and careful monitoring often allow lower overall exposure while still providing relief. Living with constant pain is exhausting, and the desire for relief is completely understandable. The goal is to find the balance that eases the body without placing an unnecessary burden on the mind. The eighth involves certain antipsychotic medications, particularly when used long-term or for reasons other than their primary indications. These drugs can have strong effects on brain chemistry and have been associated with higher rates of cognitive decline and other serious outcomes in older adults. They are sometimes prescribed for sleep or agitation, yet safer alternatives frequently exist. Regular medication reviews help ensure that the benefit still outweighs the risk. When these medicines are necessary, they can be life-changing, yet when they are used for milder symptoms, the cognitive cost can accumulate quietly. Awareness allows families and clinicians to choose the lightest effective touch. The ninth includes other common anticholinergics, such as certain muscle relaxants like cyclobenzaprine and older antihistamines beyond diphenhydramine. These appear frequently on lists of medications that raise anticholinergic burden. Individually, the risk may feel small, yet when several are taken together, the cumulative load becomes significant. Many people are surprised to learn how many of their everyday pills add to that total. A muscle relaxant taken for back pain, an older allergy tablet, and a bladder medicine can together create a heavier anticholinergic load than any one of them alone. Seeing the full picture is often the moment when meaningful change becomes possible. The pattern across all 9 is consistent. Higher dose, longer duration, and combination with other risk factors tend to elevate concern. The research is largely observational, which means it shows association rather than absolute proof of cause. Confounding factors such as the underlying condition being treated can play a role. Still, the volume of evidence is large enough that major medical organizations now recommend minimizing anticholinergic burden and reviewing these medications carefully in midlife and beyond. The brain has remarkable capacity to adapt when unnecessary interference is reduced. Early attention can protect years of clearer thinking and presence. Practical steps begin with a simple inventory. Write down every prescription, over-the-counter product, and supplement you take, including the dose and how long you have used it. Bring that list to your next appointment and ask specifically about anticholinergic burden and dementia risk. A pharmacist can also help identify which items contribute most. Never stop a medication on your own. Some of these drugs require careful tapering to avoid withdrawal or rebound symptoms. Your doctor can guide safer substitutions or dose reductions when appropriate. Many clinics now offer structured medication reviews precisely for this reason. Taking that list into the exam room turns a vague worry into a concrete conversation. Lifestyle supports the same goal. Regular physical activity improves blood flow to the brain and has been linked to lower dementia rates. Quality sleep without heavy reliance on sedating medications protects memory consolidation. Managing blood pressure, blood sugar, and hearing loss all reduce risk. Social connection and mentally engaging activities appear protective as well. These habits do not erase medication effects, yet they strengthen the brain's resilience. Walking each day, learning something new, staying connected to people who matter, and protecting sleep form a foundation that supports whatever medication adjustments become necessary. The combination of thoughtful prescribing and daily care creates the strongest protection available. Many people feel a wave of worry when they first hear this information. That reaction is natural. Medication has often been the thing that restored comfort or function. Learning that a trusted pill may carry a hidden cost can feel like a betrayal. The truth is gentler. Most of these associations grow with years of continuous high exposure. Awareness now, while you still have time to adjust, is a form of protection. Families who begin these conversations early often report that clarity returns once the medication load is lightened. Memory is not only about the past, it is about remaining present for the people and moments that still lie ahead. The quiet courage to ask questions and make careful changes is itself a powerful act of care. If you have noticed changes in your own memory or that of someone you love, or if you have already had a conversation with your doctor about these medications, share your experience in the comments. Your story may give another viewer the courage to ask the same questions. If this information feels important, pass the video along to a friend or family member who might benefit. Dementia touches so many households, and quiet knowledge shared in time can change trajectories. Subscribe to Health Journey if you have not already, so we can keep exploring the practical steps that protect both body and mind. Your brain has carried you this far. Giving it the clearest possible path forward is one of the most meaningful acts of care you can offer yourself and the people who love you. The choices made in ordinary days still shape the years to come. Take the list, start the conversation, and trust that small informed steps still hold the power to protect what matters most.